Hi everyone, my name is Sarah Schumann and I do education and outreach for CranioRehab. I'm also a speech language pathologist and we are just a small little medical device company out of Denver, Colorado. So today we're going to talk about trismus therapy in the OraStretch Press. To begin talking about trismus, we first have to know what is the typical average opening in a healthy adult. And the number you want to keep in your head for that is 50 millimeters. It's a little bit smaller for women, a little bit larger for men. If you're using that 3-finger method, you should be able to insert three fingers vertically between your front teeth like this. Now, we also do have some scales that you can use to help measure opening. The most common scale, the most well-known scale that we have is our rotation scale. It looks like this. And as you can see, millimeters are along the edge here. There's a little divot here that can either be placed on the front teeth or gently placed on the gum, and it rotates upward. So it looks like this. What's most important with the rotation scale is consistency. If you put it on a certain area, you always want to put it on the same area so that you have a comparison over time. We also do have our prong scale. And as you can see, it has this piece here, which is really great for patients with a very limited opening. It slips right between the teeth like this. Both scales also do have a lateral scale on the bottom, which can look at lateral movement of the mandible. So the way that works is you take that little purple divot, which is a 0, you line it up with the middle of the top front teeth, gently press it against the bottom lip, and have the patient move their mandible to one side. Do it to both sides and then you have a nice comparison. You're expecting about 8 to 12 millimeters of movement per side. So what is trismus? Trismus is considered to be 35 millimeters or less of opening, or if you're using that 3-finger method, it would be if the patient's having difficulty inserting 2 fingers between the front teeth. So when do you decide to order a device to help your patient? Well, if you have a patient who's high risk, they have oral or nasal cancer, and then on top of that, they've had radiation that affects the pterygoid or masseter muscles, or if pre-treatment that patient already had a limited opening, you want to get an OraStretch Press. If those are not true and they've had oral or nasal cancer, then you want to keep an eye on their opening, and as soon as they start to lose millimeters, then you would go ahead and prescribe the patient a device. So here is the OraStretch Press. It is our jaw motion rehab system. You can see there's a scale on the side. We also do have a limit screw that you can use to limit the opening. It opens to 50 millimeters, which if you remember is the adult average opening. We really only recommend using the limit screw in the head and neck cancer population for patients who are very anxious about doing their exercises, or if you have a patient who you're afraid is going to overdo it. We do have 3 different sizes. So this is the standard size. We also have a pediatric size, which is great for patients 10 or under. And then on top of that, we also have an extended version. As you can see, the bite plates are slightly misaligned in the extended version. That allows for a better fit for patients with a severe over or under bite. We do free size exchanges, so we traditionally recommend that you start with the standard size, and if that does not fit a patient, we will exchange it. We also will do some customization of the device if you have a patient with microstomia or who has flap surgery and has difficulty inserting the device. So we can cut down both sides for a patient with microstomia, or if they've had flap surgery, we can cut down just one of the sides. Just let us know and we're happy to help. Now, in terms of use, to begin using the device, the patient does need 6 millimeters of opening. And that would not be fully inserting the mouthpieces. That would be using the very edge of the device wedged between the teeth to start getting some motion. To fully insert the device without bite pads, the patient does need 9 millimeters of opening. Now, with both of the standard bite pads, it's about 15 millimeters of opening. And the bite pads, the standard ones, indent to the teeth, forming a little bit of a mold. We also do have edentulous pads that are fluffier and more soft on the gums. You can cut them as needed to fill in for dentition and to help out where they are missing their dentition. So please feel free to adjust the bite pads as needed to make it fit your patient's mouth. So how do you know when to begin using the device? Well, for those high-risk patients, the ones we talked about who have radiation to the masseter pterygoid muscles, or for those who before treatment had that limited opening, we recommend starting either with radiation or immediately following radiation. In terms of treatment, as soon as you noted they started losing opening, you want to get them a device and get it going as quickly as possible. It's very simple to use, one-handed insert, gentle squeeze. I usually say in terms of stretch, it's about a 3 on a scale of 10. We never want our patients to have sharp pain. If that happens, I recommend that they go back to the doctor and have a full checkup to make sure that there's nothing else going on. Otherwise, it's normal for them to have a little bit of soreness, just like if they went to the gym and worked out their muscles. So what protocol do we recommend for this population? Well, it used to be the 5-5-30, but we had a lot of complaints from patients that 5 times a day was just too much. So we now recommend 3 times a day, 5 stretches that they hold for 30 seconds. Okay. In terms of this, I usually recommend that they do it before breakfast, lunch, and dinner if they're still eating. It's an easy way to remember to do their exercises, gives them a nice stretch before they eat, which leads to compliance. Immediately after stretching, they will have more gains, maybe 2 to 5 millimeters that they will see. However, across the week, it's really slow going. You're only expecting them to make 1 to 2 millimeters of gains. So they are going to need to be consistent with their exercises, and they are going to need to do it long term. We know that with time, with radiation fibrosis, the tissues will tighten and harden again if they aren't doing their exercises. So we do recommend that they stick with this protocol for the rest of their lives. However, I'm also very aware that that's very difficult to stick with anything 3 times a day for the rest of your life. So I'd recommend that they make it part of their nighttime routine, brush their teeth, do their exercises, go to bed. That way, if they do start to lose opening, they know immediately and can bump up those exercises. So what do you do for patients who have hit a plateau and aren't progressing? Well, we have these power bands. They look like this. They come with the device and they provide a slightly different type of stretch. The power bands slip on the handle, and the more that you add, the more resistance there is. So here's 1. Let me show you 3. You can see that's a lot more resistance. Okay, so just like with anything, you would want to build up to 3 bands and you would want to build up to 30 minutes. To use it, they would squeeze the bite plates together, insert between the front teeth, and allow it to spring open. It will actually sit in the mouth without them holding it with their hands. So by adding an extra long stretch to their routine, it helps overcome those plateaus. If you want more information on this or have questions, please feel free to reach out to me at any time. A common question we have is, how do we order this? Well, we have a very straightforward prescription order form that you can use. You would then submit that by fax, email, or also we have it available online. We will then check insurance billing and coverage, and we will reach out to the patient directly to let them know what their coverage is and help them with the ordering process. This is what our prescription order form looks like. You can see that on the top section is the place for the doctor's information. Then immediately under that is for your information as well as the patient's. Please fill out as much of this as you can. However, don't worry if you don't have all of the information. We will reach out to the doctor as well as the patient for anything that is missing. As you can see, there's a note section on the bottom, and I recommend that if you want to know what the insurance coverage is for your patient, write it in that section and we will reach out to you as well. The reason I mentioned that to you is that we do have a financial hardship program. So if the device is not covered for your patient, let me know and I'm happy to work with you to make sure that your patient does get the device. In terms of insurance billing, as you can imagine, it's very difficult. It really depends on what state you're in, what plan your patient has. We do know that traditional Medicaid does cover the device at 80%, sometimes at 100%, depending on what their supplemental is. Other insurances typically cover it with a radiation diagnosis. If it's not covered, we do provide a 20% discount. We also do payment plans. And for Medicaid patients, if it's not covered, we provide a 50% discount. But like I mentioned before, if your patient doesn't have coverage and won't be able to afford it, please let me know and I'm happy to work with you. Thank you so very much for your time. We would love for you to connect with us on social media. We have a small presence there. And if you have any questions or if there's any way that I can help you, please feel free to let me know and I'm happy to help.